Good afternoon, everyone. Welcome. Thanks for joining us for today's webinar. This is a partnership webinar series between the University of Illinois Extension, Rural Partners, and the Governor's Rural Affairs Council. I have the honor and privilege to serve on the Governor's Rural Affairs Council as the Health and Healthcare Committee Chair. On that committee, I work with Liz Vogt, who's the Chief of Staff at the Illinois Department on Aging, and we serve on the Health and Healthcare Committee together. This is a partnership. As I said, this is part of a webinar series we've been doing. This is the third. We've already had one webinar a few weeks ago from Liz with the Illinois Department on Aging. We've had one with Department of Human Services talking about their services, and then today we're talking again with Illinois Department on Aging, and it's going to be more of a roundtable discussion on their state plan on aging. So if you're not familiar with Rural Partners, we are the state's Rural Development Council. We are a volunteer board. We have membership dues that come in that help cover the services that we offer, the activities. We really try to connect people with resources and work with communities. So if there's anything we could do, we're happy to do that. We're always looking for more members. If you're interested in more information, we'll be happy to provide you with that. Just let us know. Again, happy to partner with University of Illinois Extension on these webinar series that we have throughout the year, and this one in particular in partnership with the Governor's Rural Affairs Council. So with that, I'm going to go ahead and Nancy's with University of Illinois Extension. She'll be putting some things in the chat. I'm sure if you have questions, let her know. She usually sends a recording out, as well as if there's any slides or anything to share afterwards, she'll send you a follow-up email with whatever follow-up information is needed. So I am going to now hand it over to Sandy Pastore, who is the division manager with Home and Community Services at the Illinois Department on Aging, as well as Liz Vogt, who's the chief of staff at the Illinois Department on Aging. And they're going to kind of talk through the roundtable discussion on the state plan on aging today. So thank you all for being here, and thanks for all of our partners.
Great. Thank you so much, Laura. This is Liz Vogt with the Illinois Department on Aging, and my colleague Sandy Pastore is here. She's going to kind of set the context, provide some background information on the development of a new state plan on aging, share some demographics about older adults and our aging population, and then really open it up for discussion to get feedback from your corner of the state. So Sandy, I'll turn it over to you to get us started.
All right, thanks, Liz. So hello, everybody. I'm Sandy Pastore. I'm the division manager for Home and Community Services at the Department of Aging. Like Liz said, we're getting ready to do our new state plan on aging. We do one every 3 years. This is actually every 4 years this time, because we did get an extension so we could get back onto into rhythm with the area agency's plan on aging. So we'll get to that in a minute. But the mission of the Illinois Department on Aging is to serve and advocate for older Illinoisans and their caregivers by administering quality and culturally appropriate programs that promote partnerships and encourage independence, dignity, and quality of life. So keep this in mind as we go about our presentation today, because we like to hit on those tenets as we develop our state plan on aging. So our agenda, we're going to do a little overview of the state plan, what it is, overview of the aging population, and then what are we currently doing, those services and the current impact, some considerations for aging, like looking at age-friendly communities and things like that. And then we'll have discussion. So the state plan on aging is a plan that integrates the overarching findings and goals from the regional area plans to create a comprehensive, actionable statewide plan that is data-driven with performance measures that moves Illinois forward in better serving older people and family caregivers. So the area agencies on aging, the state is divided up into 13 regions. And so we have 13 different area agencies on aging, and they're really responsible for that regional advocacy, planning, coordination, interagency linkages, information sharing, monitoring, and evaluation. They do a needs assessment, and they develop their own 3-year state area plan on aging, which informs the 3-year state plan on aging. We have 3 statewide initiatives that we're looking at for this state plan on aging. So we're looking to increase statewide visibility of the aging network, to connect services and supports that encourage independence, dignity, and quality of life as we age. We want to drive continuous quality assurance and improvement activities that emphasize person-centered and trauma-informed services while maximizing effectiveness of services delivered through the aging network. And then we want to increase public awareness and knowledge of caregiver needs, as well as resources and services available throughout the state of Illinois to promote increased caregiver engagement and person-centered, trauma-informed, and evidence-based programs and services. Last year, we did a series of caregiver roundtables across the state where we found that our services have a low visibility rate among older adults, family caregivers, across the state. So we want to increase that visibility of the aging network. The state plan on aging and the Older American Act services in general have targeted populations. We're looking to really serve people of greatest economic needs, so people falling below the federal poverty level, and then greatest social need. So greatest social need has expanded to include all of these different elements that are listed here. So physical and mental disabilities, language barriers, cultural, social, and geographical isolation, including due to racial and ethnic status, Native American identity, religious affiliation, sexual orientation, gender identity, or sex characteristics, HIV status, chronic conditions, housing instability, food insecurity, lack of access to reliable and clean water supply, lack of transportation or utility assistance needs, interpersonal safety concerns, rural location for our rural friends here for this meeting, and then any other status that restricts the ability of an individual to perform normal or routine daily tasks or threatens the capacity of the individual to live independently. And then the state and area agencies on aging can also look at other needs that further identify greatest social need. And our new Older American Act rules, so recently we just got new Older American Act rules. They hadn't been changed since the 1980s, so we're really excited. And they did include an updated definition for multipurpose senior center, so allowing them to include mental and behavioral health as an element of their services, as well as virtual programming. And then the family caregiver definition changed to include family caregivers of adult family members or other individuals who have a Alzheimer's disease or related disorder with neurological and organic brain dysfunction. So that could be a person of any age. Sorry, my dog's barking. The new Older American Act rules also have areas of focus. They're looking to expand their focus to purpose of services to include person-centered and family-centered and trauma-informed. And they're also really a focus on quality assurance. So a little overview of the aging population. So this map here is how the Illinois Department on Aging divides the state into the planning service areas. And this is where all the area agencies on aging, they oversee these areas and develop plans for those areas. So looking at this map, you can see, 1, 3, 4, 6, 7, 9, 10, and 11 are all very rural. And then 5 and 8 also have rural counties in them as well. So as we go through the numbers here, you keep that in mind. So the older adult population across the state, we're looking at persons age 60 and older. There's 2,881,558 persons that are age 60 and older. But then you can look at age 75 and older. You can see there's a drastic decrease there where we go from 2.8 million to just 800,000, a little over 800,000. And then you go 85 and older, and we're down to 262,000 individuals. And you can see this in the chart above. This is the percentage of older adults per PSA of the total population. So we'll look at rural area, PSA 10, that's in the southeastern part of the state. And you can see there that 28% of their population is age 60 and older. 9.4% of their population is age 75 and older. And then 3% of their population is age 85 and older. And we have seen that age 85 and older population grow from being like 0.5 to 1% of the population to what we're seeing now, where it's, 2 to 3% of the population, many of our planning and service areas. And so for a long time, and I think it's still true, the age 85 and older is the fastest growing age group of our population. This is looking at race and ethnic group at age 60 and then at age 75. You can see that there is an increase in the white population where there is decreases in the Black and the Hispanic population, as well as the Native Hawaiian and the 2 or more races and American Indian. The Asian population has a slight increase. Living alone, we look at this because we are concerned about social isolation and the impact on loneliness that can have on folks. So this is the percent of individuals who live alone, who are age 60 and older in those different PSAs. PSA 12, that is Chicago. You can see we have a lot of people living alone in Chicago, whereas like PSA 10, even, that's 28%. So that's one of our more rural areas, PSA 9. So still a lot of people living alone. I think this is interesting. This is occupied housing, owner and renter. And you can see that in the more rural places, there's a more home ownership than there is in maybe some of the more urban areas, but we have across the board about 35% of all of the occupied housing that's occupied by homeowners are occupied by homeowners who are age 65 and older. So this is the percent of the population of persons age 60 and age 75 and older who are in poverty. In some areas, it pretty much stays the same. In some areas, we do see a decrease, meaning there's less people in poverty at age 75 and older than at age 60 and older. But then in other areas, we see that increase where the poverty rate is higher for persons age 75 and older. I think this slide is interesting. This is persons who are experiencing difficulty, and then again at age 60 and then age 75. We do see more people with ambulatory difficulty, so people having trouble getting around, people having trouble living independently, and then hearing difficulty. And I always think it's interesting because there's a correlation between hearing difficulty and cognitive difficulty. So that's something to pay attention to. Caregivers, we have a lot of caregivers throughout the state. About 1.3 million just here in Illinois are family caregivers to older adults, 58% of which are women. Many caregivers are providing care for at least 20 hours a week, and then 13% are providing care for more than 40 hours a week, which makes it really hard to hold down a job as well. 23.1% of whites, 24.3% of Black African Americans, 76% 17.9% of Hispanics, and 10.2% of Asian Pacific Islanders are caregivers. 21% of older LGBTQ have provided care to friends as compared to 6% of people who are not LGBTQ. 54% of LGBTQ elder care recipients receive care from their partner. 64% of caregivers have chronic conditions of their own. 29% have depression. Caregiving can be very lonely. And 14.3% are in poor physical health themselves. Looking at the Older American services and the impact that we have across the state. So our Older American Act services are delivered through our area agencies on aging who fund direct service providers to perform these services and reach all of the older adults across the state that we hope we can reach. So you can see here, over the last year, we were able to serve 471,104 older persons through all of these different types of programs like congregate, home delivered meals, nutrition counseling, chore, which is like a housekeeping, assisted transportation, legal assistance, information and assistance, and then some classes to help be preventative, like health prevention classes, like matter of balance and things like that. We also serve caregivers. We serve 20,283 caregivers in FY23 through counseling, training, supplemental services, case management, support groups, respite, information and assistance, and then public information services like public events, things like that. We served 1,977 older relative caregivers. So these are older relatives who are taking care of children. So through counseling, training, supplemental services, case management, support groups, respite, information assistance, and public information, those public events. We also have RSVP, which is Retired Senior Volunteer Program. For almost 5,000 people participated in that. We had 445 foster grandparents. We have some state funding for the older relatives raising children too, and we served an additional 1,500 people through that. There's the CACFP, which is the food program through the USDA that helps adult day services provide meals. So we had 42,000 people that we got served through that. And then Title V, 253 people participated in that program to help find a job. Also at the Department of Aging, we had a benefit access application that helps with free rides and then your license plate sticker. 134,848 people were served through there. We have over 150,000 people calling our senior helpline for information and assistance. We go and do SHIP outreach, and we have SHIP counseling that serves a lot of people. SHIP is the Senior Health Insurance Program. So if you have any questions about Medicare, those are your folks. And then there's also something called SHAP, MIPA and BAA. That's just another funding mechanism to help with those benefit applications. We also have something called Illinois Care Connections. This is providing technology to older adults across the state. And in FY24, we were able to provide over 1,000 pieces of equipment to people across the state to help them with their quality of life and be connected. We also have adult protective services. So this is helping people who are in abuse and neglect and exploitation situations, as well as self-neglect. So 20,759 reports were investigated in FY23. And then we have the Community Care Program, which is our Medicaid waiver program. And it provides in-home services, emergency home response services, adult day service, and automatic medication dispensers. So 131,153 older adults participate in that program. Choices for care. So if you find yourself in a hospital or in a long-term care facility for rehab, there's choices for care coordinator that will come out and see you and help you get set up with services should you want them in the community. Oh, and then we also have our long-term care ombudsman and our community ombudsman program, and they were able to help over 145,000 people last year. So as a whole, we're doing a lot here at Aging. We're trying to serve as many people as we can. We do have an issue with visibility and making sure that people know about our services. So thinking about aging and social determinants of health and thinking about people's life and their lifetimes and what they've been exposed to and what they've had and what they haven't had. So when you think about your life, think about it, education, quality jobs, housing, healthcare, safe environments. These are called social determinants of health. And so they help to healthy your in quality of life you will have based on these elements and access to these elements. Additionally, the World Health Organization has a model for active aging, and they look at four pillars: health, lifelong learning, participation, and security. So those pillars help provide a framework to develop a long and fulfilling life. Additional considerations to think about for our discussion today. We do have that growing aging population. We have a more diverse older Illinoisan population than we've ever had before, and we're growing in diversity. We need to think about the impact of ageism and those intersections with ableism, racism, sexism, homophobia, transphobia, xenophobia, classism, and how that all interacts, and in the quality of life issue with that. Also, we have volunteer shortages and workforce shortages and limited resources. Additionally, I want you to think about age-friendly communities. So age-friendly communities are communities that help to bring people together and build on older people's abilities to meet basic needs, learn and grow and make decisions and be mobile, and build and maintain relationships and contribute. So it's really about inclusion. So for discussion, I'll go through these discussion questions and then we can come back to them. Does that sound good? So you kind of line up what you're thinking. So what supports, I'm going to say this first, we're all aging. So whether you're age 60 and older or 30 and older, 40 and older, whatever it might be, we're all aging. So what supports do you need to improve your health, your security, your lifelong learning, your ability to connect with people, and what could help you feel more connected to your community? So that's one of our questions. And then another is thinking about your own experiences. Have you ever felt like you were treated differently based on your age, education, physical ability, your race, sexual orientation, or your identity? And then if we had an age-inclusive culture, what kinds of things would we see in our community or our state? And then thinking about your own aging and or being a family caregiver, what are the biggest challenges? What would make it easier? What do you enjoy most about older age? And ultimately, what matters the most to you as you age? And then the last one is if any other challenges or barriers that should be addressed through the state plan on aging. So I'll go back to that first one. And I'm going to take my slides down so I can see people. And we can put them into the chat. question.
Sandy, while we're doing that, there is one question in the chat about sources for the data that you used. I know as part of our state plan planning process, there are different elements that we have to examine that are sort of captured within the definitions of greatest social need and greatest economic need that help us identify what are the important demographic factors to look at. So we do use a variety of sources for the data, but maybe you could talk a little bit about where you compiled all of the statistics on our older adult population from.
Yeah, of course. So all of the data is from the census, except for the caregiver data, which was from, I believe, a caregiver report from the CDC in SAGE. The programmatic data of all of the how many people we've served is all our internal data that we have from our reporting. All right, so let me get our discussion question into the chat here. Okay, so what supports improve your health, security, and lifelong learning? And what could help you feel more connected to your community?
And you can feel free to unmute yourself or type in the chat, whichever is easier for you.
And also thinking about it from a rural perspective, you know, if you have, what are the supports in the rural community? How do you access them? How do you get there? What are the lags or the gaps in services? And you know, what is it about maybe rural areas that put up more challenges in getting people access to services? Yes, transportation, I see that in the chat. Good quality medical care. So internet access. The more skilled nursing beds. Are your communities having, we've been hearing in some areas of the state about nursing homes shutting down and people having to go to communities far from their home in order to get the rehabilitation services or long-term care services they need. Affordable support for caregivers that's not income-based. Yeah, responses can be submitted at a later date and time. I can give you our email address for older Americans, and you can send information there. I'm going to put it in the chat right now. Affordable health premiums for seniors. We do know that health insurance costs increase in rural areas, and that's based on the density of the population. So housing might be cheaper, but healthcare is more expensive.
So I think Nancy's question is a good one about models for addressing social isolation. And I think Sandy there's a difference between being socially isolated and being lonely. And so I think the strategies to address those differ a little bit as well. Um, we have several different tools in the toolbox that we use to address social isolation and to try to provide opportunities for older adults to come together in the community, whether that's at an adult day site or a senior center in the community, to engage in social interaction and activities. We also, as Sandy mentioned, our Illinois Care Connections program. We are trying to sort of bridge that tech digital divide by providing tablets and hotspots for internet access to older adults so that they can Zoom or FaceTime or do, telehealth visits or, order groceries or prescriptions, things like that, to feel more connected. I do think that was an interesting comment in the chat about local newspapers. That's it really speaks to where our people in our communities get their information, whether that's through a local newspaper outlet, through internet, through social media apps, connecting with people locally or what have you. But I thought that was an interesting comment.
Mm-hmm. All right. What about the second question here? So thinking about your own experiences, have you ever felt like you were treated differently based on age, education level, physical ability, race, sexual orientation, and identity? And so we're really looking at that intersection of ageism and all the other type of isms that people may have experienced throughout their lifetime, and as well as people that may have not experienced those other isms in their lifetime, but now are experiencing ageism. And how does that change your perception of aging, or how has your perception of aging changed as you age, I guess is another way of looking at it. And then if we had an age inclusive culture, what kinds of things would we see in our community or our state?
Oh, Sheila Edwards, you have your hand up. If you want to unmute yourself.
Thank you. Can you hear me?
Yeah.
With the aging part, I just wanted to talk about a little bit about how, because I am a senior, and how sometimes seniors are viewed as maybe not being as competent as other people in certain settings, and when really we are the experts in a lot of different ways because we have lived experiences in education and those types of things. And I think that was brought home a little bit, somewhat by Biden being the president. I'm not bringing politics. I'm just saying his age being considered, he was too old to do something, and I don't think we're ever too old to do anything. And that's what lifelong learning is all about. If we want to do something, you can certainly go learn it. I'm a college student. I'm 72 and a college student, but that's because I like the lifelong learning part. I've always loved that. And I do think that more seniors should think about, if you're retired and you don't really have anything to do, rather than be stagnant and sit at home, enroll in school and take something you're interested in, or maybe get that degree that you never got or you started. So that's what I want to talk about with age.
That's awesome, Sheila. Thank you. See some replies here in the chat where people have experienced racism or ageism or sexism. So making sure you have people to talk to. Right. Another one getting their master's of public administration at 66. Wonderful. And I think there, you know, some universities also offer auditing classes, and I'm not sure if that's a less expensive way of being able to participate in that type of environment. But also, you know, like people have said on the chat in here already, they're in rural communities in particular, you might not have access to a local college or university. Most areas have some sort of a community college, which is really great, but not always. Yeah, libraries. Libraries are a really big part of, I think, our aging network in a couple ways. Number one, they get local funding to support aging. So if you don't know that, then you can let your local library know that you now know that, so they can help you do some programming. But they're a big part of our aging network too. Just I know our area agencies on aging are often working with local libraries to put on programs and do outreach and, you know, kind of meet people where they're at. So, wow, you have to pay for the local library? What area is that, Susan?
Logan.
Oh, Logan County.
So I can speak to that too. Where I live, I'm in Menard County, which is northwest of Sangamon County, central Illinois. And because we don't live in the city limits proper, we also have to pay an annual library fee. I think it's similar to what you pay, Susan. It's maybe like $100, $94, somewhere in there per year. But if you're not contributing to if you're not paying the city taxes that go towards the library, their revenue, then you purchase a membership for the year.
So I think Nancy, you have a question here. So really the way our funding works and the way that local organizations can tap into that funding is through the area agencies on aging. They do usually annual grants. Sometimes it's a 3-year grant. But they're probably in the midst of doing it right now, actually. So if you want to contact your local area agency on aging and see what kind of funding they have available for community-based organizations, and if your organization does the type of things that they're looking for, then that might be something that you can apply for. Yeah. Local government, you know, we have a mixture of community-based organizations that provide our services. We have a lot of not-for-profits, mostly, you know, not-for-profits. But then we do have some local municipalities that have stepped up and do provide those services. Some are doing so by doing some intergovernmental agreements with their other neighbor municipalities so that it can make their resources go further. And they contract out those services to those ones. So that's another way of looking at it too, because I know sometimes municipalities are hamstringed by their geographic space. So whereas our services might, you know, you might need to provide services for the whole county, and you know, you might be the village or something within that county. So you'd have to look at intergovernmental agreements and things like that. So what about this next question then? A model of an intergovernmental agreement to share. I don't off my top of I do know that Oak Park Township does do this with River Forest Township, so that might be a place to start. We're looking for a template on how to do that. So thinking about your own aging or being a family caregiver, what are the biggest challenges? What's going to make it easier? What do you enjoy most about getting older? And what matters the most to you? These are big questions. Gotta dig deep for these ones. Family and friends. Yep.
I'll chime in and say health. Health is important as we age, maintaining wellness.
So thinking about who's going to take care of you should you need care, if you don't have family, you know, who are traditionally the ones that do that. Yeah. They'll availability of resources, being able to maintain life and be fulfilled. Sounds like all of you are ready to age well. Yeah, you got all the tools in your toolbox here. Now we got to get the word out to everyone. That's it. I mean, I think that's the essence of aging well is being connected to others, having good health, feeling secure, you know, knowing that you have shelter and food and you can afford your medicine. I think that, you know, should you need it, that kind of stuff. Having things that are satisfying in your life. And I can't think of the name of the person. I think it's but it's looking at the 7 stages of life and at you know, and towards the end of your life you want to be able to look back with ego integrity is what they call it and say, you know, I had a good one. Yes, Erickson. Thank you, Lydia. I knew that you would have it. Erickson stages of development. So looking back and being able to say, hey, you know, I did good in this life. And then the stage before that is looking and helping, you know, with generativity and helping others, and volunteering is a good way to do that. Fitness centers, having more fitness centers. I know some senior centers have fitness centers inside of them and some don't. As you guys might know, if you've seen one senior center, then you have seen one senior center. They're not all the same. Sheila, do you still have your hand raised, or is that from before? Yeah, we hear that a lot too, caring older adults who are caring for adult children who are disabled, and thinking about the support that's needed there. Ken, in that situation that you just put in the chat here, is there anything that could make it easier? Like what kind of services or resources would would be helpful?
Well, we do get, I'm in Champaign, and so we do get, for a short period of time, we have um, therapists come in as well as nursing to check on him. And yet his care continues to be more challenging and more difficult because he has multiple health issues that have kind of compounded each other over the years. Most recently, this year, as we have been in the hospital in and out for a total of almost 5 months now in 2024. And so with this increase of caregiving, we're asking for, help to come into the house. And there literally isn't anything, because as an adult who's below 50 years of age or below 65, there really isn't anything available. But this might be a good place for me to ask, has anyone had experience with the PUNS group that provides services for people who are disabled?
Yeah. Are you connected with Doors at all?
Yeah, we are connected to Doors, and we are personal assistants to our son, although we're personal assistants even though we're doing nursing tasks. So that's allowed because we are family members.
Right.
But should we get another personal assistant, they can't do the things that we're doing. They can't give meds, they can't touch the patient, they can't bathe the patient. So now we have to go to a higher level of service, CNA, LPN, and it's just finding those people is very difficult because COVID didn't do anyone a favor in terms of the healthcare industry. And so, yeah, a lot of people have left the industry, and it's very, very difficult to find somebody.
And you're in Champaign, so that's
yes, and I'm in Champaign. Yeah.
Yeah. Wow. We are hearing that in our for the older adult population too, with the negative impact of COVID on the healthcare workforce and the human service workforce in general.
Mm-hmm.
It's we're hoping to be able to rebuild and get some programs in place that will help with that. But we do have that population lag too, that, we didn't look at it today, but the other side of the population equation is that there's a reduction in the number of younger people as the older population is becoming more robust. And so when you think about that, that's really our upcoming and our current workforce.
Yeah, and we do see that in Champaign, because in the hospital we see community college nursing students come through doing their training, and that's very encouraging. But yeah, the numbers are probably still not sufficient to replace the current population of caregivers and nursing population.
Yeah, thanks, Ted, for that suggestion there. And then Lydia, you had a question here about the state plan on aging, and then there's something called the multi-sector plan on aging, and we have all these plans for aging, and how do they align with each other? There's also IDPH, I believe, is writing a plan for dementia and aging, or dementia across all ages, really. So when we were thinking about our state plan on aging, the state plan on aging is really like our grant to the federal government that says, hey, this is what we're planning to do over the next 3 years with the funding we receive. Here's our initiatives. These are the things we're working on. But we're really kind of regulated to the funds that we currently receive and how we're planning on moving those to support the older adults and family caregivers across the state. So while it's really focused on older American services, we are going to be encompassing kind of all the services that we looked at today that the Department on Aging performs, either through contracted providers, grants, or services we do ourselves. The multi-sector plan on aging, which we're really excited about, we had an executive order from the governor getting this going. And what that is doing is it connects all these different state agencies and stakeholders together to say, hey, you know, the Department on Aging has identified transportation as a huge issue across the state. But the Department on Aging doesn't run transportation across the state. We do some funding of local providers, like you saw in our slide. But as a whole, you know, that's not what we do. There's a whole sister agency that we have, which is IDOT, that runs all kinds of transportation across the state. So how do we get them into the fold and say, hey, transportation, let's make a goal for aging. How do we get better transportation systems so that people can get to the places they need to go and want to go in a way that doesn't take maybe all day long? So those are some of the goals that will be developed with the multi-sector plan on aging. So really looking across all these different state agencies. I think there's 14 that were identified in the executive order, and say to them, hey, let's get a goal for aging. Let's work together on aging. Let's make aging better in Illinois through all of these different systems so that we're not siloed with just the Department on Aging focusing on aging. Hope that helps. All right, let me share my screen here. We do have some upcoming roundtables. So if you're in the area, we have one. We just had our very first one today and down in PSA 8, which is in southwestern Illinois. We have one tomorrow, which is it's in Mount Vernon, Illinois. It's in area 9, 10, and 11. And all of these are on our calendar online, and we can put that in the chat here for you. And so here's the rest of the upcoming ones by PSA. Here's some information. So if you want to stay connected, here's our website. If you have ideas, please send us an email to aging.oas@illinois.gov. We have our senior helpline should you have any questions or things that resources that you need. If you need to report abuse or neglect or self-neglect or exploitation, please call the Adult Protective Services hotline. And just thank you. Thank you for coming together today and providing some feedback. I'm hoping that we'll be able to grab that chat because there was a lot of really good things in there. And really appreciate all of you. Thank you.
Thank you so much. There's a lot of great resource links there. And you can always share those with us via email as well. And I've got some compiled to maybe send to you that you could add to as well. But we really appreciate everyone's time. Really great. Liz and Sandy, thank you so much for leading this education and discussion today. Feel free to add anything written if you want to add anything written as well as a message. But we are really grateful for your time. And folks, thanks for staying on for the hour. And hope you all have a great rest of your week. Thank you again.
Thank you. Have a great day, everybody.
Bye-bye. Take care. Thank you.